Okay, let's unpack this. We've got the stack of revision notes focused on chorioamnionitis, and the mission for this deep dive is, well, pretty clear. Pull out the absolute must-know points, the high-yield essentials you need to feel sharp and confident on this topic.
Exactly. We're cutting through the noise, sort of, to get straight to what's crucial for recall. Think of this as distilling those notes into the core understanding you need.
Okay, good. So let's dive right in then. At its core, what is chorioamnionitis?
Simply put, it's an infection, specifically an infection of the membrane surrounding the baby, the chorion and the amnion and the amniotic fluid itself. The key mechanism here usually is bacteria making their way up from the lower genital tract into the uterus.
Right.
And it's really important to remember, as these notes highlight, this isn't just any infection, it's a medical emergency.
Right, medical emergency. That definitely sets the tone. So
Yeah.
what causes it? Which bacteria are the main culprits we need to keep in mind?
Primarily bacteria, yeah, ascending from below. The notes list the usual suspects: Group B Streptococcus, E. coli, and a range of other aerobic and anaerobic organisms. While like fungal or viral causes are possible, the focus for recall should definitely be on those bacterial players.
Okay, so mainly bacteria moving upwards. What makes that journey more likely? What are the key risk factors that should make you, extra vigilant?
Well, think about anything that breaches or bypasses those natural protective barriers or prolongs exposure. The notes highlight several. Prolonged rupture of membranes, that's a direct opening, isn't it?
Yeah, makes sense.
Prolonged labor, multiple vaginal examinations, which can potentially introduce bacteria, internal fetal monitoring devices, and even just maternal colonization with bacteria like GBS beforehand. These are the factors that significantly increase the risk.
That makes total sense, giving the bacteria opportunity and access.
Yeah.
And once they get in, how does the infection actually progress?
The pathophysiology. Yeah, the notes explain it pretty well. Once the bacteria are there, they trigger a strong inflammatory response. This leads to the release of pro-inflammatory cytokines, basically chemical signals that call in the immune system and create that whole cascade we see clinically.
Got it. So inflammation is really central to what follows. And how common is this condition overall, epidemiology-wise?
The epidemiology varies a bit, but the notes give an estimated incidence of about 1 to 4% of pregnancies, so not super rare.
Right. Now, for recognizing it in practice, the clinical features, this seems crucial. What does it actually look like? What signs should immediately scream chorioamnionitis?
Yes, this is critical for revision. You need to look for the combination of signs. The absolute cornerstone is maternal fever, usually defined as over 38 degrees C.
Okay, fever first?
But it's rarely just fever alone. You'll often see uterine tenderness. The uterus is painful to touch.
Okay.
The amniotic fluid might have a foul odor that's quite specific.
Right.
And crucially, watch the heart rates. Both maternal tachycardia and fetal tachycardia. The mother's heart rate goes up, and so does the baby's, often an early sign of distress or response to infection.
Both tachycardias. Good point.
Exactly. And finally, maternal blood tests will often show leukocytosis, a high white blood cell count, which is that inflammatory response we just talked about kicking in.
Okay, so fever plus tenderness or maybe smelly fluid plus those fast heart rates and a high white count, that combination sounds key for pulling it all together. If you see those signs, how do you confirm it? What investigations are recommended?
So the notes point to blood tests, including checking inflammatory markers like C-reactive protein, CRP, remember that inflammation?
Yeah.
CRP goes up sharply in infection. Blood cultures are important, too, to try and identify the specific bacteria causing the problem.
Makes sense.
Amniotic fluid analysis can be diagnostic if you can actually get a sample. And continuous electronic fetal monitoring is essential to constantly assess the baby's well-being.
Okay. And just briefly, what else could it be? Things to rule out, the differentials.
Yeah, you've got to consider other causes of fever or discomfort in labor, right? The notes mention ruling out things like a straightforward UTI, other viral illnesses perhaps, or even non-infectious inflammatory conditions. It's about looking at the whole clinical picture.
Right, context matters.
Yeah.
So once it's diagnosed or strongly suspected, what's the management approach? What do the notes say we do?
Prompt action is vital, reflecting that medical emergency status we mentioned. The core treatment is antibiotics, broad spectrum initially, targeting the likely bacteria. Supportive care for the mother is also key, fluids, fever management.
Okay.
And then there's careful delivery planning. The decision on when and how to deliver depends on, gestational age, how mom and baby are doing, but often delivery is expedited.
Right, getting the baby out of that environment. And what's the outlook, the prognosis?
With timely diagnosis and effective management, the prognosis is generally favorable. Rapid treatment really is the game changer here. However, the notes are very clear that untreated or severe cases carry significant risks for both.
Which brings us neatly to the potential complications if it's not caught or treated quickly. What are the main risks listed?
These are serious, and they really underscore the urgency. For the baby, risks include preterm birth, neonatal sepsis, that's infection spreading to the newborn's bloodstream,
Oh, wow.
and respiratory distress syndrome, often linked to prematurity and the infection affecting lung development.
Okay. And for the mother?
For the mother, complications can include postpartum endometritis, an infection of the uterine lining after birth, and critically, maternal sepsis, which is a severe, potentially life-threatening systemic infection.
So pretty serious consequences all around. What does this all mean when you put it together? What's the big takeaway?
I think it really highlights just how rapidly chorioamnionitis can progress and the severity of the potential outcomes if it's not recognized and managed quickly. It's a condition where clinical suspicion and prompt action, based on those key signs we talked about, are absolutely paramount.
Absolutely. It's a powerful reminder of that dynamic interplay between maternal and fetal well-being during pregnancy and labor, and why staying sharp on these conditions is just, well, non-negotiable. And if you found this deep dive into chorioamnionitis helpful for your revision, remember you can find full revision resources over at pastthemsra.com.
And for free revision materials to get you started, definitely check out freemsra.com.